So welcome. Thank you for joining me for the podcast. Maybe please start with introduction. Just tell everyone about yourself and maybe how you got in this field.
Okay, I'd love to do this, and thank you for inviting me. So, my name is
Thank you.
Adelle Forth. I'm a professor of forensic psychology at Carleton University in Ottawa, Canada, and my research focuses on individuals with psychopathic traits. So, I've been doing this research for many, many, many years. I started at the University of British Columbia in Vancouver,
Okay.
where I initially thought I was going to be a lawyer. I have a twin sister who became a lawyer, but I took a class
Uh-huh.
from a person called Robert Hare, who worked at the University of British Columbia. And we
Okay.
can talk more about Robert Hare. He's an extremely famous individual. And I took his class in
Mm-hmm.
third year. I was doing a psychology degree. And I walked in the class, and it was supposed to be a class on forensic psychology. I said, "Oh, that sounds interesting." And he comes into the front of the classroom. He says, "I don't know anything about forensic psychology." Well, we all look at each other, the other students, thinking, "Oh, this doesn't sound good." But he says, "What I do know is I know a lot about psychopaths." And I said, "Psychopaths?" I had never even heard of psychopath. Remember, this is going back to 1980, so a long, long time ago. But I said, "Well, it
Okay.
sounds interesting." So certainly, we spent the 12 weeks talking about psychopathy and his research, and I became intrigued by this. I volunteered to work in his lab, and that was history. Then I did my BA, MA, PhD with Bob Hare,
Mm-hmm.
and I'm still fascinated by psychopathy. There's still so many questions we haven't answered. So then I didn't graduate. I moved to Carleton University in 1991, graduated with a PhD in 1992, and have spent all my career looking at and trying to understand individuals with psychopathy.
That's fascinating. Why do you think people are so fascinated about psychopaths? There's so many movies, documentaries. It's almost like they are kind of like a different species of humans, and everyone is kind of fascinated with them. What do you think that is?
Well, I think in some extent we are always interested in sort of the dark side of humanity. Maybe they seem so normal, right? They have this facade of being normal. And if you think back to a very
Mm-hmm.
classic book, and the book was by Dr. Hervey Cleckley, he's a psychiatrist from Georgia, United States. He wrote this book
Mm-hmm.
called Mask of Sanity. I'm freezing. Am I okay with
Right, I heard
first?
about that.
Oh,
Yes, yes, yeah, you're
so
good.
I can keep going. Sorry, I'm freezing. I have very poor internet connection
Yeah.
down here. Anyway, let me repeat. Dr. Hervey Cleckley, American psychiatrist, wrote this book
Mm-hmm.
called The Mask of Sanity. Classic. Listeners
Mm-hmm.
out there, everyone should read The Mask of Sanity. And he talked about this
Right.
mask that individuals with psychopathic characteristics have, where they appear normal, but really there's a deep-seated deficit underneath this facade. So that's why when you if you Google psychopathy, you often see these pictures of a mask, right? And that
Mm-hmm. Yeah.
they have this persona. This reminds me of Anne Rule, who wrote the book Strangers Beside Me. And Anne Rule wrote this book about Ted
Mm-hmm.
Bundy. And Ted Bundy, a very infamous serial
Okay.
killer in the States, Anne Rule was
Mm-hmm.
working up the crisis line at the university, and the person beside her was Ted Bundy. So here he's a serial
Mm-hmm.
killer, and she would be listening to him talk and showing compassion and concern on the telephone with students who are phoning in who are in
Mm-hmm.
crisis. At the same time, he's out there targeting vulnerable university students, sexually assaulting them, and killing them. So that's why
Right.
she wrote the book Stranger Beside Me, because she said she had no clue who this person was. So I guess it's,
Right.
to think that there
Because he
are individuals.
clearly,
Sorry, go ahead.
it seems like they clearly understand human emotions very well because they sort of have to understand them in order to act, right? And deceive and stuff like that. But yet they don't feel the same way as other people. They can totally understand it, so they're not illiterate in that sense, but they have no personal connection to those feelings and emotions. And
Yeah,
is that
actually
what
that's
it
a
is, you think?
yeah, that's a very good way to put it. So it's what we call the emotional paradox. So they're able to read emotions in others because that's how they can manipulate and exploit them, but they don't feel the same amount of emotions. Now, that's not to say they don't feel any emotions. I think that's a misnomer. That's too extreme. They certainly feel anger,
Right.
especially narcissistic anger. If you do something to insult them, right, or to thwart what they're trying to get, they will often react in a pretty verbally and physically aggressive manner, for sure.
Right. Right. Have you heard about this study? I think it came out 10 years ago, maybe, where they found, and I wonder if the study is like fully accepted in the scientific community, or was it just something that sort of appeared and went nowhere, that psychopaths are able to sort of turn on and off like a switch their empathy. So they actually did some brain scans on prisoners. They were showing them images, and they came to that they can actually sort of turn on and off when they feel empathy and when they don't feel empathy. Is that correct?
Well, certainly that study that you're referring to, yeah, they did look at, they scanned 18 offenders who had many psychopathic traits and then compare them to controls, community sample. And what they did was well, in the scanner, they had the individuals would look at individuals with hands, loving hands, like hands that would indicate love versus hands that would, hitting someone that would indicate a aggression or pain, or hands that were rejecting, that sort of thing. So they had the individuals in the scanner. They looked at their brain activation during this. And initially, when they just watched this, didn't give them any information or instructions. Certainly, there were neural differences in the psychopathic offenders while they watched these loving and particularly painful hands. They didn't respond in the same way. But when the researchers told them, we want you to imagine how that person would be feeling, right? And so when the instruction was imagine how that person was feeling, they didn't see the significant difference. I think you start talking about that study is quite a high profile study. Now, the issue will be first, you have to be very cautious when you have 18 participants. We have in psychology, we talk about the need for replication. So don't put all your eggs in one basket with one study with 18 individuals. Until you can replicate the findings, right? I'd be cautious. There is research suggesting that individuals with psychopathic traits do fine with what we call cognitive empathy. So cognitive empathy is being able to understand and identify another person's mental state. So I think by giving that instruction to imagine how that person would feel, that's why they wiped out the differences. Individuals with psychopathic traits have a problem with what we call affective or emotional empathy, sharing the emotional state with another person. So I think that's more specific to the deficit we see, right? So psychopaths can understand what's morally right and wrong. They simply don't care. Okay, so they know the rules and regulations of society. They know what they should be doing, right? But they don't care to. So they don't bother about it.
Right. They don't bother. Right. You mentioned that you sort of specialize right now in aspects of psychopathy in relationships. Could you elaborate on that?
Yeah, but you know what I think we should do before we start, unless you're going to introduce what psychopathy is, it might be useful for the listeners to know what about the construct we're measuring. Is that true or?
Sure.
Okay.
Sure.
Well,
Yeah, we can do that.
I think what the problem is when you ask someone to think of a psychopath, right? Who they imagine are people like Hannibal Lecter, fictionalized serial killers, highly intelligent individuals who can manipulate the FBI, etc. Or they think of serial killers we focused on Ted Bundy, but let's say Ted Bundy. If we ask the community sample, students, anyone, probably the most prototypical psychopaths people will think of, if you asked them to think of who comes to mind, would be Ted Bundy. Now, most psychopaths are not serial killers. Most psychopaths do not commit murder, right? So an individual with psychopathic traits, there's sort of 4 clusters or symptoms. So 4 groupings of features or traits. They're interpersonal traits like superficially charming, right? Grandiose, manipulative. So that would be the interpersonal traits. There's the affective or emotional traits, things like lack of remorse, lack of empathy, which we've already talked about for others, shallow emotions. Again, we've mentioned that trait as well. There's also the lifestyle or behavioral traits. They're very impulsive. They need, they're risk-taking. They're irresponsible. And there's some more antisocial traits. They engage in problematic behaviors very early on, and it persists, and they're very diverse in their antisocial behavior. So that's the cluster of traits, and that you might think, oh no, I have one of those traits. That's okay. It's to be labeled or to have problematic behaviors. You tend to score high on most of those traits. Okay, so that's what we mean by someone with psychopathic traits. And it's on a continuum or a dimension. I think you use the word spectrum, but it's a continuum. Someone may have mild number of these traits, moderate number, or severe. And not all psychopaths have all these traits. So they vary. There are different types, in other words, of psychopaths. Okay, so you asked me where am I, what about research right now? So in the last, I'd say, most of my career, I've studied individuals with psychopathic traits. And that includes adults, sex offenders, adolescent offenders. So I've looked at, the individual with these traits. But in the last, I would say about 8 or 9 years, I realized that the voices of victims have been ignored. There was no research, none. Looking at the other side of the coin, what about individuals who have been involved? And when I say involved, I've done research looking at, let's say you date or you get romantically involved, or you marry someone with psychopathic traits within the workplace, your boss or supervisor or your coworker has psychopathic traits. So I focused on those 2 domains, but there's also, we're starting to do research looking at what happens if your parent has psychopathic traits or your sibling. And then what I want to know, what is the impact on you? So that's where my research is focused now. And I can tell you more.
On the victim.
On the that's well, and you see, we use the word victim. Now we have to be careful about our terminology. Certainly, given what they've experienced, you might want to use the word victim because there's been lots of abuse and harm they've experienced, and very high rates of depression and post-traumatic stress disorder and trust issues. But some individuals talk about how they became more resilient after being involved. And they see themselves more as survivors rather than victims.
Right. Because it seems like they got tricked, especially in romantic relationships. They got tricked into the relationship, and then the psychopath uses different manipulation techniques to keep them in that state, and it usually exploits them, right? That's the usual dynamic, I think, that we see.
Yeah. And I think with the increase in the online and in the internet, it used to be quite a bit more difficult for individuals with psychopathic traits to find individuals who are more or less vulnerable. But with the onset of internet dating and chat, all of the internet, it's made their job, should I call it a job, made what they do so much more easy, right? Because here's someone, let's say I'm just I've just got divorced. I'm looking for another partner. So I go on this dating website and I'm genuine. I write my profile. Maybe I lie a little bit about my weight or whatever, but I'm pretty genuine. I'm saying this is what I like. It turns out I like ferrets and I like dogs, and I might write that in the profile. And let's say, assume you have the psychopathic traits and looking for someone, you read my profile and says, oh, here's someone who's, right, I don't know, very involved in climate reform or likes animals or whatever and then you think, well, the best way for me to hook her in would be to talk about this, mirror what she is talking about.
Right.
So yes, you're quite right that individuals with psychopathic traits, I don't know if they may be somewhat better at identifying vulnerable cues, and that's a whole area of research, and there's some research suggesting they are. But they are looking for individuals who are vulnerable or seeking some sort of relationship, and then they just feed them information that person's looking for. They also are, I've done one research with one of my honor students, looking at this construct of love bombing. So excessive flattery, excessive amount of gifts, excessive compliments. Oh, you're the only one. You understand me so well. All those other women never did understand me, but you really are so astute. So all of these compliments. And so then this person sort of gets ensnared with this individual. Then this individual starts showing their true colors, right? That they're very controlling. They're very isolating. One thing about psychopathic individuals, yes, they engage in a lot of emotional abuse, huge amount of emotional abuse, lots of deceit, right? But the one thing that seems to make them slightly different for others, they're really focused on material resources. Financial abuse seems to be very, very common with individuals with psychopathic traits. I mean, they value that more than affection and love or attachment. What they value is what they want to get out from you and out of you, and what they want is material resources like money.
Right. So that's usually how they abuse their victims. Usually, it comes down to material things, money.
Well, there's not, but there's
not
also
so much emotional, right?
No, they've done 3 studies, and about 90. These are individuals who report they've been involved with someone with psychopathic traits. So it's not the best methodology because I don't have the access to the other, like the person with the psychopathic traits. They're not volunteering. So it's the individual reporting back on the psychopathic traits of their partner or ex-partner. But there's like 95 to 98% report emotional abuse. Emotional abuse is extremely common. Belittling them, and that sort of thing. Then the most common is deceit. I think that doesn't. Then it's financial abuse. About 70 to 75%.
So the emotional. Okay, so the emotional abuse, is it just for the sake of sort of sadistic abuse, like they just enjoy hurting emotionally their victim or their partner, or is it an outcome of something else? Like they just completely don't care about the other person, and then as a result, they sort of abuse them emotionally. So is that sadistic, or is it just a sort of like a side effect of something else?
Yeah, I think that for some individuals, it's sadistic for sure. But in other individuals, it's a way to control your partner, right? So if you want to control someone, rather than be sadistic, if you start, isolating them and putting them down and, telling them that they'll never be anything, that you can't leave me, you can't be without me, that sort of thing. That's more of sort of what we call coercive control, right? So they may not be, sadistically getting out. I mean, some may, but I don't think it's necessarily. There'd be a whole bunch of different motivations, shall we say, for engaging in emotional abuse.
Right.
I've also looked at red flags. I know you mentioned red flag. Do you want me to talk about the red flag stuff now, or?
Yeah.
Well,
great.
I asked. So I've done a very
let's
large
talk about red flag.
Okay, red flags. So I've asked a large group of individuals who are involved in an intimate partner, whether or not, looking back on what their relationship, were there any red flags, right? In the hopes to maybe help. So in about 20%, they said no, there was nothing. They had no clue this was going to be such a horrific relationship. No clue. But then certainly the most common was how evasive the person was. So when you're meeting someone for the first time, you might ask them about, their family history, their jobs they had, what school did they, just general information that you'd want to know. But these individuals said that this person simply would not answer those questions. They kept asking them questions. Oh, what about you? Tell me about you. Tell me about you. So trying to gain information from them and not answering. So how evasive they were and elusive they were in answering questions. But then also sometimes they would tell these really far-fetched stories, like that they had a degree from Harvard or Oxford or something like this, but could not back up the information. So sort of elusive, but then these very sort of almost outrageous stories, right? I can't tell you who I work for because, maybe they hint they work for the FBI or something crazy like this, right? I'm in a Secret Service type.
Right.
There was no evidence that they really were, right? So they just make up these stories. So that was one. The other one that came to mind, or what they talked about, is how arrogant and dominant the person was. They came across as being very confident. And even though they didn't talk about themselves much, but they had that persona. And I already mentioned that they were overly attentive and lots of flattery. And the last one I'll mention was they were also quite aggressive and short-tempered. So this person mentioned how they had their first dinner at this really fancy restaurant, and they were chatting about things. And then the waiter came up and was serving some food and accidentally spilled the glass of water. And the psychopathic individual just went into this rage towards this poor waiter. And this person who was on the date felt so embarrassed and uncomfortable that this seemed like such a trivial, event. And there was so much anger. Another person talked about how they were driving somewhere with this person and someone cut them off or didn't signal or something. Again, this very strong outburst of anger that she said, I should have realized something was not right. But I just, I wrote it off. There seemed to be a whole bunch of other positive features. I'm going to just mention one more example, and then we can move on. I do dogs a lot. And this the oldest person who participated in our survey was 71 years old. So there was everyone from age of 18 to 71. And what she mentioned, which I found intriguing, was this was way back, she's 71, so we're talking many, many years ago. When she was 18, when she went on a date, the person who was going to date her had to come to her house, and her parents had to sort of interview the fellow to make sure he was safe for their daughter to go out with. And she said this guy came to the door, and she opened the door. She invited this guy in. She was 18 years old. I assume he's around the same age. Invited him in. And she says her very friendly dog growled at him. Took immediately dislike to this guy. He came in, sat in the living room sofa, and her parents were totally charmed by this individual, thought he was wonderful. So she went on the date, and it turned out things went horribly poorly for her. And her last comment was, I should have believed my dog. He got the accurate read on this.
So animals seem to...
Yeah. Who knows?
Right. So animals have a sixth sense when it comes to people. That's interesting.
I don't know. That's
but, I was actually... Right. But it was interesting what you said, and what I've read actually about psychopaths is that they are impulsive. The feature of impulsiveness is quite common. But at the same time, you hear a lot about psychopaths as, CEOs or politicians, where they have to be very calculated and almost cold, and they're very good at controlling their emotions. So it's almost in stark contrast. This, a psychopath is very impulsive versus the one who's very controlled. So does it mean there are two types of psychopaths, or is it some inconsistency?
Well, I think you're quite right. There are different variants of individual psychopathic traits. And I think it's a myth that there's research by Paul Babiak and Bob Hare looking at the prevalence of psychopathic traits in CEOs, and it's around. Yes, it's higher than in the general community. So it's about 5%. So it's not like 80 or 90%. So it's the myth out there that there's all these corporate psychopaths running around, but so I don't think that's true. So, but yes, there's a higher prevalence than in the, and you're right that there's as I mentioned, there's a constellation of features. So I think those individuals with psychopathic traits in the corporate world probably have a lot of the interpersonal features. They're very superficially charming. They're very dominant and grandiose and arrogant. Those sort of features. Very manipulative, right? They manipulate others in the workplace. They're also probably pretty. They have the emotional traits. They're callous. They lack compassion for others. They make decisions that could have, really impact others' livelihood and lives. But they may not be as impulsive or lacking plans. Obviously, they have specific goals, so they may not have as much of these lifestyle or behavioral features, but they certainly have these interpersonal and affective features for sure. And that makes, if you are working with someone, and I've done research looking at the impact of having a boss or supervisor, we found, in this one study, we found extremely high rates of harassment and bullying behavior and different types of bullying behavior. So about 75% of our participants who said my boss or coworker had psychopathic traits, they experience what would be labeled as actual workplace bullying. Whereas in the general community, about 5 to 10% of the general community experience bullying behavior in the workplace.
Okay, interesting. And that feature of superficial charm, would you categorize that as a red flag, where you meet someone and they are very smooth, very charming, almost too much, like they seem too good to be true? Is that one of the red flags that
Absolutely. If your gut reaction, I know maybe this is not empirically sound, but you have that sensation that this person is just throwing all this information at you, and they're trying to manage their impression to make this fabulous impression so that you would want to be with this individual, right? Or want to maybe get hired by this individual, I would think that would be a major red flag, right? Turn around and run is what I would suggest, right? You're not going to change.
Right.
These individuals have been, there's very early onsets of some of these traits and features, and it's made them, they are pretty successful in what they do. So they've exploited and manipulated others for most of their lives. We're talking about adults. And for you to think that you could go in and change this behavior is pretty unrealistic.
Right. So that was one of my questions. Is it possible to change the psychopath or to rehabilitate them or maybe cure him from that affliction? Or is it something their brain is wired this way? There's no way for them to ever change?
Yeah. Well, I don't think we know enough about the etiology or the causes of psychopathy to make a firm conclusion. So certainly individuals with psychopathic traits are very resistant to intervention. And there's many reasons for this. One, they don't see anything wrong in their behavior. So if you don't see anything wrong with your behavior, right, and you don't feel any anxiety and remorse when you hurt others, it's going to be very difficult for a therapist to say, you know what, I think you need to change, right? Because these people are not intrinsically motivated to change, right? They're motivated to change, maybe because other people are saying you better change or else. Or if you want to get out of prison, you better change or you'll not get released. So it's going to be very challenging to change someone's behavior when they don't think there's anything wrong with it, right? Because most people who want to change, they have high levels of anxiety or depression about their mental health. And that's what was what going to
Right.
want to change. Also, therapists find individuals with psychopathic traits pretty challenging to treat, right? Because they go in, they say, sure, you want me to change? Tell me, doctor, what I should change. And they're very, they also engage in manipulation towards the therapist as well. And so you get a sense that
Right.
these people are not very sincere or genuinely wanting to change. Having said all that,
Right.
certainly there's research showing that in offenders, if you provide pretty long lasting, not like a 6-week program, 8 months to a year program, cognitive behavioral treatment program, that you can get reductions in reoffending when you release these individuals from prison. But now, when I say reduction,
Right.
we're not talking about a cure. I don't think we should take cure off the table. We should talk more about management of their behavior, right? So you need to
Right.
think about how you're going to address intervention that fulfills their needs, need for excitement, need for dominance, right? So you need to be probably taking any treatment program and thinking about what works best. Now, there's research looking at younger samples. There's quite a bit of research looking at the younger you go, the more successful you are. So when we're talking about younger,
Okay.
we're talking about family therapy with toddlers, age 3 to 5, really, really young, and looking at parental management treatment and emotional recognition treatment to try and increase empathy within the child and have different strategies. Punishment does not work with individual children with psychopathic traits. It does not work. You need to focus more on reward-based intervention in order to make change.
Okay.
So there's quite a bit of research now. I think very promising research looking at more at sort of prevention versus intervention with adults. I don't know if that answered your question.
Right. Because they have they don't experience fear the same way, so they're not going to be afraid of the punishment, right?
That's right. Yeah, certainly even young children, they've looked at what's called a fearless temperament. So nor do they respond as much to sort of the negative punishment. They say, "Oh, you hit your sister. Don't you feel bad because she's crying?" And the child with these traits doesn't feel bad. That's the problem. No, I don't feel bad. So they don't develop remorse, and they
Right.
don't develop the empathy. So you have to think of different ways to manage that behavior, right? And I think that is going to
Right.
be where the future holds. I think once you're talking about a 30 or 40-year individual who has a lifetime of exploiting, manipulating, using others, it's hard for me to see how we're going to really change that individual to make them into a caring, compassionate individual.
Right. So it's almost like, you need to develop some sort of framework or rewards that that person would get for acting not selfishly and with compassion. If they
That's
see
right. Yeah.
value in that, they would probably act this way. Yeah.
Absolutely. Yeah.
How about are there any occupations or jobs that people or psychopaths are uniquely suited for or are really good at? And are those jobs useful for the society? Like I would
Well,
imagine something to do with military where
yeah. Oh, absolutely. Yeah. Any job, you can think of special forces, right? You're sending someone into extremely high risk situation where there's a high likely, and they have to stay cool, calm, right, under very high risk. So it sounds like, well, yeah, that'd be a perfect job for individual psychopathic traits, except if there's someone who doesn't like following the rules and regulations in the military, they could get themselves in trouble, right? So, I mean, there's a combination of traits. You can think of, well, certainly, I think individual psychopathic traits are attracted to any occupation that gives them control. So, military, policing, security. But then you can think of, well, within the police force, what individuals with psychopathic traits, are they going to be the best police officers? We've heard lots about police officers who overstep their boundaries, right,
Right.
and use excessive force. Now, I'm not saying anyone in particular has psychopathic traits, but certainly there's research showing that those you would want to screen in for compassion, empathy, right, as a police officer, rather than so they can learn to de-escalate, right, situations with individuals, let's say with mental health problems, rather than to screen out the psychopaths. Why don't we screen in for opposite traits? I mean, I think it'd be liability
Right.
wise very difficult to use, let's say, a psychopathy checklist and say, okay, you can't come to the military, you can't do this and that. But if we screen in for the opposite of psychopathy, then that's fine, I think. And then by default, we'll
Right.
minimize the number of traits. I don't know of any, yes, they talk about how individual psychopathic traits would be good at sales. Probably, yes, marketing
Mm-hmm.
and sales. But would they be then go over the, manipulate, right, in that context as well. So I can't think of a
Right.
single,
That's very likely.
yeah, occupation where someone with psychopathic traits would be always, I mean, there's always a mixed bag. There's going to be negatives and positives probably.
Mm-hmm. It seems like so many generations, and yet people with psychopathic traits survive and they're still here. It's almost like maybe there's some utility in society for a very limited amount of people with those traits, with fearlessness and stuff, and they are useful in certain contexts. Um, that even for like the survival of humanity in a way, but there shouldn't be too many of them because then society will collapse basically.
Yeah. Well, certainly there's a lot of research. Well, not a lot. There's a lot of there's the evolutionary perspective on psychopathy. Certainly that
Mm-hmm.
anything that will increase your reproductive capability. And you think of individual
Mm-hmm.
psychopathic traits, yes, they tend to have more offspring. Yeah, and nowadays, yes, they will have
Yeah.
more. They're more promiscuous. They have more offspring. They tend to leave the offspring, but for men, at any rate, there's the mother there looking after the child, and nowadays, social welfare. Right, we're supporting. Right, so I think for reproductive success, an individual with psychopathic traits, if you can establish relationships with other, right, and have intimate relationships,
Mm-hmm.
and you could be quite successful and in the reproductive sense of survival, right?
Right. That's interesting. Um, Sorry, my computer is freezing a little bit.
Okay.
Um, okay, another question I was actually quite curious about, um, to do with actually Holocaust. It's a pretty common topic, but it seems like all those people working in those camps, um, and working in even administrative roles, and committing the Holocaust. There's so many of them.
Hmm.
And so it almost seems unlikely then that every single one was a psychopath, right? There's just so many of them. So I was wondering if maybe because of brainwashing and propaganda that was common, in Nazi Germany, is it possible that those people really believe they're doing something for the good of society, and their belief was so strong that they didn't have a problem with doing all these horrible crimes? Um, do you think that's a possibility?
Well, I don't. I mean, I've not studied any of this, so this is only my personal opinion.
Mm-hmm.
I would think, given the,
Okay.
yeah, given that people can be brainwashed, I would think the answer is
Mm-hmm.
probably yes. I doubt very much that all of the
Okay.
guards and all of the individuals rounding up people were putting them in the railway tracks and taking them off the concentration camps and convincing them to strip down and go into the gas chambers. I think many of them probably did believe, how perverted this belief would be, is that they were doing something good for their society, right? That this was something positive that they were doing.
Mm-hmm.
Certainly, there would be other individuals who are masterminding all of this and manipulating the masses, who probably had many more psychopathic traits, right? But the individual,
Right. Right.
guards they probably had quite. I mean, if you looked at their family, they probably had showed compassion and caring towards their family members, right? But they just sort of said, "Well, this
Right.
group was not is not my family." But what you find with individuals' psychopathic traits, they don't differentiate family from others. So they will mistreat their family members
Mm-hmm.
just as much as they mistreat a stranger. They will steal from and manipulate their
Oh,
family
really?
members. And so I think you'll find that if you did a detailed examination of the SS guards, you'd find that no, they were pretty compassionate. And some of the guards were also compassionate within. They would try to sneak food in and do things like that, right? So I think you'd find
Right.
that, yes, your explanation is certainly very plausible. I mean, it's hard to understand how they could not
Mm-hmm.
see what we're talking, but, if they were brainwashed and they put this in a compartment, these people were not like us. They were out to get us. They were, whatever. It's like in war, right? To anyone shooting someone, right? Some people in war talked about how they would always
Mm-hmm.
shoot and try to miss the person, where other people thought, well, I need to kill this
Right.
person because they're going to kill me and my family, right? It's in defense.
Right.
So you can see that those individuals are not necessarily psychopathic at all.
Mm-hmm. So it's a really good example because it just shows how powerful propaganda can be, and also like power dynamic where you have an authority above you that tells you it's okay to do all those things, and almost you have to do those things. So you have that safety that nothing will happen to you if you commit those crimes, and the authority tells you that it's actually for the better good. Then you can have people who are not psychopaths at all. They can commit horrible things
Mm-hmm.
because they are almost programmed to do so, right?
Yeah. Oh, absolutely. Yeah. I think that would explain why they
Mm-hmm.
would engage in these acts, for sure.
Right. That's very interesting. Um, Maybe could you talk a little bit about dark triad, what it is exactly?
Okay. Certainly, there's Del Paulus, who's at UBC, and Kevin Williams. In
Mm-hmm.
2002, they proposed that there's these dark personalities, and they talked about the dark triad. And the dark
Mm-hmm.
triad being that there's uh okay, so the dark triad being that there's psychopathy, right? And we've already talked about what psychopathy is. There's narcissism,
Mm-hmm.
right? So people who are narcissistic,
Mm-hmm.
they're very selfish, they are arrogant, they lack empathy, and but what makes them quite different from individuals psychopathic, they're very sensitive to criticism and insults. So they talk about the
Okay.
two distinctions between a vulnerable narcissist versus a grandiose narcissist. We can come back to that, but let me talk about the dark triad.
Mm-hmm.
Then there's the individuals with Machiavellianism, and people high on Machiavellianism, they are manipulative, they are insincere, and they're quite deceitful. So you can see why Adele talked about these dark personalities or these socially adversive personality types. There has been that whole construct of the dark triad. There's now hundreds and hundreds. It just took off. I think the research world just loved this idea that these different types, and they actually I think it was in 2000, I don't remember, 2010 or 2012, Del Paulus added a dark tetrad. It's from the triad to the tetrad, and they added
Okay.
everyday sadism to the construct. So now there's 4 dark personalities. And now there's all this research looking
Okay.
at the different associations between these 4 or 3 personalities and different outcomes. Oh, there's research on everything from
Mm-hmm.
cheating in university students to aggression and violence. You name it, the dark triad has been examined. So they are
Okay.
related to each other for sure, but they're not the same.
Mm-hmm.
Uh, and
Right.
uh, and certainly there's some research now looking at what's called the light personalities. So there's the dark personalities. Now, more recently, there's researcher Kaufman has developed what's called the light personalities. These are personalities who show a lot of compassion and caring for others that are opposite to the dark triad. So that's
interesting.
Yeah. And there's research. I mean, it certainly has, if you think of who are the individuals who score like high on the dark triad, tends to be males, younger individuals.
Is there a reason for that? That's interesting.
Well, it's also interesting that if you look at outside the dark triad, if you look at in the area of psychopathy, psychopathic traits, in offender samples, in forensic psychiatric samples, in community samples, in university samples, men tend to score higher. Now, not hugely higher, but on average, men score higher. And maybe, you can look at things like risk taking. That maybe doesn't surprise you. Men score maybe higher in other risks. So some of the components of psychopathy, but in general, yes, men score higher than women. Now, there's this scale that developed by Robert Hare at the University of British Columbia that's used around the world for the clinical assessment of psychopathy called the Hare Psychopathy Checklist. And some researcher clinicians have criticized this because when Bob Hare developed the scale in the 1970s and 80s, he went into prisons, but he only went into male prison samples. I mean, there wasn't that many female offenders. And that's where he developed his scale. So there's been some criticism saying, well, that scale is somewhat biased because maybe we're missing some of the features of psychopathy in women, right? And so maybe maybe it's more of a measurement issue rather than a true construct difference. But the fact is that all the self-report, there's lots of self-report scales. All of the other scales that have since he developed his scale also tend to show gender differences. So maybe it's a true finding that men have more psychopathic traits than women.
Right. Or maybe women sort of fly more under the radar. It's like it doesn't manifest, the psychopathy doesn't manifest in women as strongly as in men, or maybe there are different things that women do that are less frowned upon in societies, for example.
Right. Well,
that's a result of the same sort of brain structure.
Well, that's what some people have said, right? That if you're looking at women, tend to have more nurturing approach, and then again, if you got someone with psychopathic traits, they might hide. They may not be so overtly aggressive, but maybe more covertly aggressive, and we're missing that. And they might be more engaging in that behavior within relationships rather than outside in the community, when men might be more overtly aggressive outside in the community, and it's easier to detect this. But again, we don't really. We'd have to know more about the causal mechanism of psychopathy and then look at it. Again, most of the research is still in prison, and forensic psychiatric facilities are still happening with men, mainly because there's such a differential rate of incarceration for men versus women, and that's true with the forensic psychiatric system as well. But we do find the difference in community samples too, right? But again, it could be a measurement issue as well.
Right. Is there any correlation between psychopathy and ADHD?
Okay, so looking at when you're looking at youth or children, there's three what we call disruptive disorders. There is oppositional defiant disorder, it tends to be seen earlier in childhood. Then there's conduct disorder, often manifests later, and then there's attention deficit hyperactivity disorder. And the strongest association between adolescents is with conduct disorder. So psychopathic traits is strongly related to conduct disorder. It's also related to oppositional defiant disorder, and it's less strongly, but still associated with ADHD symptoms. So the answer is yes, but there's not a strong association with ADHD. And that's, again, ADHD is composed of different features or symptoms, and one of them is being impulsivity and inattentiveness. So I think those features are what overlaps with the features of psychopathic traits in adolescence.
Okay. Okay. And with Machiavellism, it seems like Machiavellism is more common in like corporate settings versus psychopathy, right?
Yeah, well,
It's almost like you would take all your.
yeah, I would say narcissism and Machiavellianism are the two that are more common in corporate settings. Yes.
Okay. Okay.
So, but I think, and I haven't looked at this. This would be interesting to look at. I would think that would those two types, yes, they might be into manipulation, exploiting other individuals, but it's probably more the psychopathic corporate individual who's more into, harassment and bullying behavior. So, but I don't have research suggesting this because I didn't measure narcissism and Machiavellianism in the samples I have. I just looked at psychopathic traits.
Okay. You've probably interviewed a lot of psychopaths and dealt with them. In your experience, are those people likable? Is there a way that what is your sort of personal feeling when you deal with those people? Is it always a negative sort of experience, or is there anything good and redeeming about them?
Oh, I think everyone's a mixture of good and bad, but certainly interviewing in prison, let's say, individuals with psychopathic traits is much more entertaining than individuals without psychopathic traits. Most individuals in prison, they're depressed, they have poor social skills, they have high levels of anxiety, they come from very abusive situations. So they're not very outgoing, extroverted individuals at all. Most prisoners have come from pretty horrific backgrounds. Often when you're interviewing someone with psychopathic traits, it's like a whole different ballgame. You walk in there and it's sort of like, oh, hello, doctor. You're from the university. It's so nice to meet you. Thank you for taking your time to come in and talk to me. I really appreciate this. I'm so glad that you're here because, a lot of the psychologists here, they don't have very good training. And it's nice to meet someone who have all your skills that you have. Right. And so they're trying to, as soon as you get in the room, right, they're trying to manage their impression. They're very talkative individuals. They like telling stories. Right. You ask them a question, your interview can go on for 6 hours, right? Where with most offenders know that you're going to talk about what crime did they commit. And they're very embarrassed. They're remorseful. They're hesitant. They don't really like talking about their criminal behavior. So they're really kind of worried. Whereas this individual psychopath, you probably wanted to hear about what I did. The police got it wrong. Let me tell you what actually happened. And then they'll tell you a story what happened. And you say, well, according to the police report, that's not quite accurate. Oh, well, don't pay any attention to the police. They really don't know what they're doing. I think I'm smarter. So yes, the answer is, but it can get, or if it goes on too much, I usually let the individual tell as many stories as they want. But then I start asking them sort of more challenging questions, right? You said this, and now I'm confused because actually you were in prison for the last 10 years. How could you have had these 3 different jobs you just told me about? Oh, well, you're right. Okay, maybe I only had 2 different jobs. Okay, like details. Don't worry about the details. Just believe me. So certainly when you start challenging them, it's a fine line because you don't want them to get really hostile and not talk to you, right? You want to get enough information to evaluate on these traits. So certainly, yes, talking to someone with psychopathic traits, especially if they have those interpersonal features, is much more entertaining and interesting, to be honest, than most offenders who are really quite damaged individuals, I'd say.
Right. So it's almost like psychopaths are immune to all those harms and abusive behavior that happen to them.
Yeah.
In a world, they can sort of project confidence.
Right. Well, I had once, when you said that, it just triggered something in my mind. I had a student a couple of years ago who was in the
Mhm.
military, who was coming back to get a degree, and she wanted to look at psychopathic traits she was doing a paper, like a review article, psychopathic traits in the military. And she said, "Oh, I think they'll do worse in the military." I said, "Yes, I don't think they'll follow rules and regulations, but oh, what happened here? Where are you? Can you hear me still?" Yeah. Anyway, something came on the
I
screen.
can hear you. Yeah.
Okay. Anyway, so she wanted to look at this. And then what she found was, I guess, one positive aspect that relates to what you just said. She found that for military personnel, individuals with psychopathic traits have lower incidence of post-traumatic stress disorder and trauma and anxiety.
Right.
So you're quite right, as you just said,
Right.
they're immune to stress. This it could be what's considered more
Hmm.
positive, right, aspects of their behavior for them at any rate, right? I'm
Right.
not to
Right.
say we want to expose.
And that, I guess,
No, go ahead.
yeah, I guess it's sort of connected to my last question, and that is that perhaps maybe psychopathy is um, sort of like a defense mechanism that some people acquire because of some abusive, or traumatic experiences they had as a child, and sort of they develop a psychopathic brain that shields them from any harm, from worrying too much about everything, and sort of gives them tools to survive in a world that's extremely brutal
Hmm.
and violent. Is
Right.
that something that is possible?
Well, there's certainly there's been research suggesting there's two variants of psychopathy. The primary variant that's more driven by genetic
Hmm.
factors, and these individuals have they have the prototypical features: low anxiety. They don't show much remorse or guilt. They don't have strong emotions. But then there's what's called the secondary variant, and that variant is more related to trauma, environmental factors. So that as they develop, they as you say, maybe as a defense mechanism, they develop these traits as a result of the trauma and maltreatment they experience and the
Hmm.
environmental deprivation they experience. So it's not so much of the genetic motive underlying etiology; it's an environmental etiology. But they have quite high anxiety. They have quite a lot of negative emotions, depression
Yeah.
and anger that they experience, and they intend to engage in what we call
Hmm.
reactive aggression, right? In response, to get really upset by something someone says, and then they react violently. Whereas the primary variant, they tend not to be. They're pretty cold, unemotional, and they engage in more instrumental aggression, sort of thought out aggression to manipulate and use others and exploit others. So I think there may be two different causal pathways. They probably intersect a
Hmm.
lot, but anyway, two different causal pathways to the development of psychopathic traits. And I would think that latter category, the secondary category that we just, that environmentally uh, developed category, would be more amenable to intervention and treatment than the primary category. So I think you're right.
Right.
There are
Right.
different variants
And
of psychopathy.
Mhm. And it seems like that genetic factor. If I wonder, and I think there's probably wasn't too much research done on that, but I wonder if, because we know now that epigenome is sort of like an evolving thing, and let's say if a person had a grandparents that something traumatic happened during war and stuff like that, there can be some epigenetic changes that then sort of travel forward to next generations. So I wonder if the psychopaths who are born psychopaths, maybe it still has some sort of underlying background in their family history. I wonder if that's possible, I guess.
Yeah, certainly that's way outside my area, but it's something I think it'd be hard to investigate because you'd want to go back to grandfathers and great grandfathers, and how would we assess whether or not they had psychopathic traits or not, to look at how, through the generations, whether or not this would be passed down or not. But certainly there's been quite a few twin studies, right? Monozygotic versus dizygotic twins, and looking at the inheritance of psychopathic traits. There's been a number since 2005. I think about 20 different twin studies looking at this.
Okay. And what did it find?
Oh yeah, that about 60 to, it varies, of course, depending on the methodology, but about 50 to 65% of these traits are inheritable.
Inheritable. Okay.
Yeah.
Interesting.
But that doesn't.
Well, thank you so much.
To say that, that it's heritable doesn't mean you can't change things, right? And there's always genetics and environmental interactions. So I don't want to say that it's written in stone. I would never say someone's born a psychopath. I would not say that for sure.
Okay. Interesting. Well, thank you so much for your time.
Okay.
Yeah. Thank you so much.
Okay. Well, thank